1. A CNA instructor notices a student struggling with understanding patient confidentiality. Which adult learning principle should the instructor apply to enhance understanding? A. Repetition of information. B. Relating content to real-life scenarios. C. Providing written materials only. D. Using complex medical terminology. 2. During a clinical rotation, a student exhibits anxiety when interacting with psychiatric patients. What is the most appropriate supervisory approach? A. Assign the student to administrative tasks. B. Ignore the behavior, assuming it will resolve. C. Provide immediate feedback and support. D. Remove the student from the clinical setting. 3. When evaluating a student's performance in a psychiatric unit, which method ensures the most objective assessment? A. Personal opinion of the instructor. B. Peer feedback. C. Standardized evaluation checklist. D. Verbal feedback from patients. 4. A student consistently interrupts group therapy sessions. What feedback technique should the instructor use? A. Publicly reprimand the student. B. Provide immediate, private feedback. C. Ignore the behavior. D. Assign additional homework. 5. Which legal document outlines the responsibilities of a CNA instructor in a psychiatric setting? A. Patient's Bill of Rights. B. Nurse Practice Act. C. Institutional Policy Manual. D. State Education Guidelines. 6. In curriculum development for psychiatric aid training, which component is essential? A. Inclusion of outdated practices. B. Emphasis on theoretical knowledge only. C. Integration of evidence-based practices. D. Focus solely on pharmacology. 7. A train-the-trainer program should include which key element to be effective? A. Solely online modules. B. Hands-on teaching practice. C. Passive lecture attendance. D. Memorization of training materials. 8. Accurate documentation in training records is crucial for A. Meeting accreditation standards. B. Reducing instructor workload. C. Enhancing student creativity. D. Limiting student access to information. 9. An adult learner in the CNA program prefers hands-on activities. This preference aligns with which learning style? A. Auditory. B. Visual. C. Kinesthetic. D. Reading-writing. 10. To ensure compliance with HIPAA during training, instructors must A. Share patient information for educational purposes. B. Use de-identified case studies. C. Allow students to access all patient records. D. Discuss patient cases in public areas. 11. A student nurse aide demonstrates cultural insensitivity. The instructor should A. Ignore the behavior. B. Address the issue privately and provide cultural competency training. C. Publicly reprimand the student. D. Remove the student from the program. 12. When planning a lesson on de-escalation techniques, the instructor should A. Use only lecture-based methods. B. Incorporate role-playing scenarios. C. Avoid discussing real-life situations. D. Focus on theoretical frameworks only. 13. Effective mentoring in a psychiatric setting includes A. Assigning tasks without guidance. B. Providing consistent feedback and support. C. Allowing students to work independently without supervision. D. Limiting communication to formal evaluations. 14. The primary goal of clinical supervision is to A. Evaluate student grades. B. Ensure patient safety and student learning. C. Reduce instructor workload. D. Limit student-patient interactions. 15. A student fails to meet the minimum competency in a skill assessment. The instructor should A. Dismiss the student from the program. B. Provide additional training and reassessment opportunities. C. Ignore the deficiency. D. Assign unrelated tasks. 16. In developing a psychiatric aid curriculum, which stakeholder input is most valuable? A. Former students only. B. Healthcare administrators. C. Current industry professionals and educators. D. General public opinion. 17. Confidentiality in student records is mandated by A. HIPAA. B. FERPA. C. OSHA. D. ADA. 18. A student expresses difficulty understanding complex medical terms. The instructor should A. Use simpler language and provide definitions. B. Expect the student to research independently. C. Continue using complex terminology. D. Skip the topic altogether. 19. When providing feedback, the sandwich method involves A. Starting and ending with negative feedback. B. Mixing positive and negative feedback randomly. C. Positive feedback, followed by constructive criticism, ending with positive feedback. D. Providing only positive feedback. 20. An effective evaluation tool for clinical performance is A. Anecdotal notes. B. Standardized rating scales. C. Verbal reports. D. Peer assessments. 21. To accommodate diverse learning needs, instructors should A. Use a single teaching method. B. Incorporate various instructional strategies. C. Focus only on visual materials. D. Avoid hands-on activities. 22. Legal responsibilities of a CNA instructor include A. Ensuring student compliance with dress codes. B. Providing accurate and timely evaluations. C. Organizing social events. D. Managing facility budgets. 23. A student exhibits signs of burnout. The instructor's role is to A. Assign more tasks to build resilience. B. Discuss coping strategies and provide support. C. Ignore the signs. D. Suggest the student consider a different career. 24. Instructors can promote critical thinking by A. Providing answers to all questions. B. Encouraging rote memorization. C. Facilitating problem-solving discussions. D. Limiting student inquiries. 25. The most effective way to teach emergency procedures is through A. Reading assignments. B. Video demonstrations only. C. Simulation exercises. D. Lectures without interaction. 26. Documentation of student progress should be A. Subjective and informal. B. Objective and standardized. C. Based on peer opinions. D. Updated annually. 27. A student questions the relevance of a topic. The instructor should A. Dismiss the question. B. Explain the practical application of the topic. C. Redirect to another subject. D. Assign additional readings without explanation. 28. Instructors must report student misconduct to A. Fellow students. B. Appropriate institutional authorities. C. Social media platforms. D. External news agencies. 29. To enhance learning retention, instructors should A. Provide information in large, infrequent sessions. B. Use repetitive, spaced learning techniques. C. Avoid reviewing previous material. D. Focus solely on new content. 30. A student with a disability requires accommodations. The instructor should A. Provide accommodations as per institutional policy. B. Treat the student the same as others without adjustments. C. Exclude the student from certain activities. D. Publicly discuss the student's needs. 31. Effective communication in clinical education involves A. Using medical jargon exclusively. B. Active listening and clear instructions. C. Speaking rapidly to cover more material. D. Limiting student questions. 32. When a student makes a medication error during simulation, the instructor should A. Punish the student. B. Use the error as a learning opportunity. C. Ignore the incident. D. Remove the student from the program. 33. The role of formative assessment is to A. Assign final grades. B. Monitor student learning and provide ongoing feedback. C. Replace summative assessments. D. Evaluate instructor performance. 34. Instructors can model professional behavior by A. Demonstrating ethical decision-making. B. Sharing personal opinions on controversial topics. C. Displaying favoritism. D. Ignoring institutional policies. 35. A student consistently arrives late to clinical rotations. The instructor should A. Ignore the behavior. B. Address the issue and discuss time management strategies. C. Penalize the student without discussion. D. Adjust the schedule to accommodate the student. 36. Incorporating case studies in instruction helps students A. Memorize facts. B. Apply knowledge to real-world scenarios. C. Focus solely on theoretical knowledge. D. Avoid critical thinking. 37. The purpose of a learning objective is to A. Provide a general overview of the topic. B. Guide instructional planning and assessment. C. Fill space in the syllabus. D. Replace lesson plans. 38. Instructors should update curriculum content. A. Every decade. B. When new evidence-based practices emerge. C. Only when mandated by administration. D. To align with personal preferences. 39. A student expresses discomfort with a particular patient population. The instructor should A. Reassign the student permanently. B. Explore the reasons and provide support and education. C. Ignore the concern. D. Discourage further discussion. 40. Effective debriefing after simulations includes A. Critiquing student performance harshly. B. Encouraging reflection and discussion. C. Providing answers without explanation. D. Skipping the debriefing to save time. 41. The primary function of summative assessment is to A. Provide ongoing feedback. B. Evaluate student learning at the end of an instructional unit. C. Replace formative assessments. D. Assess instructor performance. 42. Instructors can support students with test anxiety by A. Ignoring their concerns. B. Providing test-taking strategies and support. C. Suggesting they withdraw from the program. D. Reducing the number of assessments. 43. A student demonstrates unethical behavior. The instructor's responsibility is to A. Overlook the behavior. B. Address the issue according to institutional policies. C. Discuss it with other students. D. Handle it informally. 44. Role-playing in psychiatric aid training is beneficial because it A. Is entertaining. B. Enhances empathy and communication skills. C. Replaces clinical experience. D. Requires minimal preparation. 45. To ensure inclusivity, instructors should A. Use culturally responsive teaching methods. B. Avoid discussing cultural differences. C. Treat all students identically without consideration of background. D. Focus solely on the dominant culture. 46. When a student lacks motivation, the instructor should A. Assign additional work. B. Explore underlying causes and provide encouragement. C. Ignore the issue. D. Reduce course expectations. 47. The use of reflective journals in training helps students A. Memorize procedures. B. Develop self-awareness and critical thinking. C. Avoid written assignments. D. Focus on instructor feedback only. 48. Instructors can foster a positive learning environment by A. Encouraging open communication and respect. B. Maintaining strict discipline. C. Limiting student interaction. D. Focusing solely on content delivery. 49. The ADA requires instructors to A. Provide accommodations for students with disabilities. B. Treat all students the same without adjustments. C. Avoid discussing disabilities. D. Exclude students with disabilities from certain activities. 50. When a student excels in clinical skills but struggles academically, the instructor should A. Focus only on clinical performance. B. Provide academic support and resources. C. Ignore academic deficiencies. D. Suggest the student pursue a different career. 51. Incorporating multimedia in instruction caters to A. Only visual learners. B. Diverse learning preferences and styles. C. Fast learners exclusively. D. Those uninterested in reading. 52. When delivering feedback to a group, the instructor should A. Focus on one student only. B. Address the group with general observations and avoid specifics. C. Highlight common strengths and areas for improvement. D. Criticize students to promote competition. 53. An instructor notices bias in their assessment approach. The best action is to A. Continue without change. B. Discuss with students for consensus. C. Reflect and revise evaluation criteria for fairness. D. Let students self-evaluate. 54. To meet regulatory standards, instructors must A. Teach only required topics. B. Document all instructional activities and student outcomes. C. Leave documentation to administrators. D. Avoid changing outdated policies. 55. The best way to evaluate communication skills is by A. Multiple choice exams. B. Peer-reviewed group discussions. C. Written essays. D. Instructor-led lectures. 56. Mentoring differs from supervising in that mentoring A. Is informal and unstructured. B. Encourages long-term professional growth. C. Focuses on completing tasks. D. Involves only classroom teaching. 57. A psychiatric aide trainee struggles with boundaries. The instructor should A. Provide ethics training and observe interactions. B. Ignore it until a complaint is filed. C. Refer the student to a disciplinary board immediately. D. Advise avoiding patient contact. 58. Competency-based evaluation focuses on A. Theoretical understanding. B. Repetition of procedures. C. Demonstrated skills and behaviors. D. Course attendance. 59. Adult learners are motivated when A. Content is abstract and philosophical. B. Material connects to their personal goals and experiences. C. Courses are longer and more complex. D. There are fewer assessments. 60. Best practices in curriculum delivery include A. Reading directly from slides. B. Asking students to memorize all content. C. Engaging students with interactive learning strategies. D. Teaching only what's in the textbook. 61. The primary purpose of clinical preceptorships is to A. Reduce instructor involvement. B. Allow students to practice independently. C. Integrate practical experience with theoretical knowledge. D. Replace formal instruction. 62. Which action violates FERPA in a CNA training program? A. Keeping student grades confidential. B. Posting names and grades publicly. C. Releasing academic records to the student. D. Sharing performance with the student's written permission. 63. When introducing a new psychiatric protocol, the instructor should A. Skip it if it's complicated. B. Ensure staff and students understand the rationale and application. C. Leave it to self-study. D. Use outdated methods to avoid confusion. 64. Reflective practice among students encourages A. Repetitive learning. B. Self-assessment and personal development. C. Instructor dependency. D. Memorization. 65. Best method for handling a disruptive student in a clinical setting. A. Immediate expulsion. B. Private redirection and review of expectations. C. Public discipline to set an example. D. Ignoring the behavior. 66. A performance-based rubric must be A. Subjective. B. Vague. C. Clear and aligned with learning outcomes. D. Constantly changing. 67. To meet train-the-trainer standards, instructors must A. Be certified and maintain continuing education. B. Only have clinical experience. C. Be trained by any available staff. D. Focus only on theoretical knowledge. 68. A strong learning outcome statement includes A. Student names and expected grades. B. Clear, measurable behaviors. C. Vague language for flexibility. D. Broad educational goals. 69. If a student requests extra time for testing due to a documented disability, the instructor must A. Deny the request to remain fair. B. Accommodate according to institutional policy. C. Ask the student to speak with classmates about fairness. D. Offer a different version of the test. 70. In mentoring, active listening allows the mentor to A. Give advice without context. B. Correct the student's emotions. C. Understand concerns and guide appropriately. D. Avoid emotional topics. 71. Regular program evaluation ensures A. Stability over innovation. B. Ongoing improvement and relevance. C. Resistance to change. D. Limiting feedback channels. 72. Which teaching strategy is most effective for adult learners? A. Rote memorization. B. Self-directed projects and real-life applications. C. Daily quizzes. D. Open lectures only. Behavioral Health CNA Psychiatric Aide. The Behavioral Health CNA Psychiatric Aide test is a specialized certification assessment designed to evaluate the competency of nursing assistants who work with patients experiencing mental health disorders, emotional disturbances, and behavioral challenges. This high-stakes exam measures knowledge and skills in psychiatric care practices, therapeutic communication, patient safety, crisis intervention, and ethical responsibilities. It also evaluates the candidate's ability to support treatment plans, provide daily care, and work within multidisciplinary teams in behavioral health settings. The test includes scenario-based questions reflecting real-world clinical challenges, ensuring that only qualified candidates are certified to provide effective and compassionate mental health care under the supervision of licensed professionals. Here are the top 5 beneficial uses of the sample exam. 1. Validates competency. The Behavioral Health CNA Psychiatric Aide test ensures that candidates possess the essential skills and knowledge to provide safe and effective care to patients with mental health conditions. 2. Improves employment opportunities. Passing the test enhances a CNA's qualifications, making them more competitive for roles in psychiatric units, behavioral health centers, and long-term care facilities. 3. Ensures regulatory compliance. The test supports adherence to federal and state training standards, helping facilities meet staffing regulations and quality of care benchmarks in mental health services. 4. Promotes patient safety. Certified aides are better prepared to handle psychiatric crises, prevent harm, and manage behaviors therapeutically. 5. Supports career advancement. Certification opens pathways for CNAs to pursue advanced roles in behavioral health, nursing, or mental health counseling.